So here is Alyssa and Taylor. Alyssa, what is your role at Apex?
I am the Harm Reduction and Prevention Manager for our HIV prevention department within Apex Community Care.
Awesome. And this is Taylor, my friend from high school.
Hey, good to see
And
you.
fellow Bethel resident still?
Yes. So I am the Health Equity and Community Engagement Coordinator. This is actually the beginning of my second week here at Apex. So
Yeah.
Awesome.
I'm tasked with a lot of different things, helping with communications, development, helping the prevention team. So we're going to talk a little bit more about our services, and also reminder, this Saturday is National HIV Testing Day, so please come in. We're here all week, 9 to 5, so please come in and get tested.
Awesome.
Cool.
All right, so, I mean, I guess, what's this drug called PrEP? What's that about? Like, 'cause we just got tested, say, you know, my results were negative, and I want to learn more about how I could just be preventative with making sure if I'm having unprotected sex, or even if I'm having protected sex, it's still better safe than sorry, right?
Yeah.
So if I don't have a primary care doctor, or if I'm interested in just, you know, getting PrEP, is there a way that I can get that through you guys? Can you talk more about that?
Absolutely. So if you're coming in and getting tested and your test comes back non-reactive, one of the first things we do with everyone, because we really truly believe that everybody who is sexually active should be on some form of PrEP. PrEP is prophylaxis.
Pre-exposure prophylaxis.
Thank you.
One daily pill you take to prevent getting HIV. That's why I'm here.
See, this is so it's a pill that you take once a day that helps essentially protect your body against HIV and having somebody transmit HIV to you. So it's your personal protection against HIV. We have a PrEP navigator, and he sets up appointments with our gastroenterologists that we're connected with, and they can help you get on PrEP. If you have insurance, we can connect it with your insurance. It's usually actually free or a very low cost for PrEP. If you don't have insurance, we also have a connection with Gilead, which is the pharmaceutical company that makes Truvada and Descovy, the two drugs for PrEP. And they have a program that helps pay for PrEP for you so that it's less expensive when you're going through the process.
And so, if I'm on PrEP, does that mean I'm protected from every other STD?
No, you still need to use condoms and other barrier methods.
Okay. All right. Well, so I guess what are the other services that you guys provide here besides HIV testing?
So we do HIV testing, STD testing, and Hep C testing. We do condom distribution, so you can come in and get free condoms, lube, dental dams, etc., and any other supplies that you might need. We also do sexual health education, so we go out into the community, into different organizations, and do workshops, webinars, you know, presentations and things like that. We also have an SSP program, which is Syringe Service Program, and we do needle exchange for our people who use injection drugs in the community to help prevent infectious diseases like HIV, Hep C. It also helps take the needles off of the street and to make sure that our users are safe and that they have a safe space so that when they are ready to get into treatment, they have somebody that can help them through that process to get into treatment. And we also do a lot of street outreach, and we do street outreach in the Danbury, New Milford, Waterbury, and Torrington area, because we do also have a Torrington office as well.
Wow. I guess just my curiosity,
Yeah.
how has the pandemic changed services, or what has that been looking like? You know, obviously people are still having sex during the pandemic.
People are still having sex, you know, especially with everyone being cooped up. So we actually pivoted and also started providing take-home HIV kits. And what we do, and it was a collaboration with the state DPH. They gave us these kits so that we could then send them out to whomever would like to get a test. So they get the test and they call us, and we walk them through the process over the phone on how to do the test at home, and then also walk them through any other additional processes based on whether the test was non-reactive or reactive.
All right. Is there any other things you want to include?
The only thing I'll say is I'll have Raghib drop our contact info in the little link with our website, Instagram, and Facebook, because we're working on updating those as well. But we're going to do a part 2 where we talk about our other services. So we've got behavioral health, substance abuse, we do Suboxone, we have MAT, otherwise known as medication-assisted treatment. We also have case management. So if your test does come back reactive and you want services, we can provide those as well.
Awesome.
Yeah.
Well, thank you so much. I'm looking forward to working with Taylor and Alyssa in the future to bring more attention and do more events and make sure that people are getting connected to important services. So that's it from us, though. Thank you so much for having me.
Absolutely.
Thanks
Thank
so
you.
much for coming.
All right.